Something very funny about diabetes. People usually think that when you do not have food for a long time, when you have had no sugar, no carbohydrates, it means that your blood sugar level will go so down. No, it doesn't happen all the time. It happens, but not always. Suppose you are fasting and in the month of Ramadan or some other time. What happens before the breaking of fast? You are supposed to have very low amounts of sugar in your blood. It's true, it happens most of the time, but it doesn't necessarily mean that all the time. It happens that when you are supposed to have 5 in diabetic scale, but it is 25. It is possible. Sometimes you think that it's going to be kind of 20 points. When you have measured, you found that no, it's 5. So it happens. Suppose you have a blood sugar level early in the morning. When you wake up, you just have it measured and you find that your diabetes is little higher. Your blood sugar level is higher. It means you are not all the time having the same blood sugar level. But because of the liver fat in your liver, it happens that even when you've been sleeping, still the blood sugar level is not properly mobilized. That's how what happens early in the morning, or when you wake up, when you measure after you wake up, you may have higher level of blood sugar level. It's because you have fatty liver. And if you have very good amount of blood sugar level, then the perfect. Suppose you're having kind of a measurement of 6 or 5 like that. It's fine, no problem, because your fatty liver is or no problem. But the thing is that when you have, even it happens that some patients say that they have had their blood sugar level measured after long fasting. It's suppose 6 when they had food, and after 2 hours when they have it measured, it's even less than that food. It happens. Why? It's sometimes like this, that when you have a lot of food, you are supposed to have a very high amount of blood sugar level in your blood, right? It should be. But the thing is that when you have a lot of sugar intake, carbohydrate, the liver will take away a lot of sugar, so that what happens when you measure it, you will find that the sugar level is not high, even when you had a very high amount of food. So it's very tricky. You cannot guarantee that your blood sugar level is this and that when you measure it at random. This is important. So what you should do is you have another measurement, that is HbA1c. This is the average of 3 months or 3.5 months or even 4 months. So it's naturally say 3 months average. So when you have 10, that is HbA1c, the average of 3 months or more than that. If it is 10, then